Prostatectomy. Introduction. The prostate is a walnut-sized gland that surrounds the urethra and sits just below the bladder. Select true or false. Correct. Prostatectomy is usually recommended when the prostate cancer has not spread to the abdomen and pelvis. Select true or false. Correct. The aim of prostatectomy is to remove all of the prostate. Select true or false. Correct. The aim of the operation is to remove the whole prostate. Are heart attacks and other anesthesia-related complications common during and after a prostatectomy? Select yes or no. Correct. Anesthesia is now very safe. However, the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as heart attacks and lung problems. Are infections very common after surgery? Select yes or no. Correct. Infections are rare, though rare infections as well as bleeding and scarring may occur. Which of the following statements is true about erectile dysfunction after a nerve-sparing prostatectomy? Choose one of the following options. 1. Most patients will have impotence if the operation does not spare the nerves. 2. Nerve sparing will always restore normal erectile dysfunction. Correct. Most patients will have impotence after prostatectomy if the procedure does not attempt to spare the nerves. In men who undergo a nerve-sparing operation, it may take up to 2 years to know whether erection will be recovered. Which one of the following statements is false about the long-term effects of prostatectomy? Choose one of the following options. 1. The patient will not have ejaculate. 2. The patient will not be able to have children of his own. 3. The patient will not be able to have an orgasm. Correct. The patient may still be able to have an orgasm, which is known as a dry orgasm, because it does not include ejaculate or the liquid that comes out during ejaculation. Thank you for using Explain.